Hi everyone, I am Dr. Thomas, your functional medicine doctor, and this is your health tip. This is one of my favorite fruits, the Julie mango, and it's that time of year again when we are all getting ready to enjoy our favorite mangoes. I don't know if yours is East Indian, but mine is Julie. This fruit is an amazing fruit. It has a great flavor. It is filled with fiber, and it has a yellow color which indicates it's loaded with beta carotene. That is the plant version of vitamin A. Those are the amazing things about mangoes, but there is a negative side, a dark side if you will, to mangoes. The fact is, mangoes, along with many other fruits, are loaded with sugar. And so this is an alert for my patients who are diabetic, who are struggling with weight, or who have cancer. Too much sugar in your diet, even from fruits, can be harmful for you. So there are a couple of terms I want you to get familiar with. One is called glycemic index. The glycemic index is the degree to which a fruit or a food will cause your sugar to go up. Fruits generally have a high glycemic index. Three of the worst fruits in terms of glycemic index is going to be your mango, your melon, and your pineapples. Melon may be the worst on the list, surprise, surprise. But mangoes are particularly well known to send your blood sugar up. So at this time of year, you want to be especially cautious. The next term I want you to be familiar with is what we call the glycemic load. That refers to the amount of sugar that it dumps into your system. And this is relevant where mangoes are concerned, because Jamaicans generally don't eat one mango. We eat 2, 3, sometimes a dozen. And so the amount of sugar that we dump into our system and the concomitant weight gain and blood sugar rise are even more significant when it concerns mangoes. So I want to be especially clear. My diabetic patients should probably avoid mangoes, but especially 2, 3, 4, 5, and 6 is a bad idea. You want to probably focus on fruits that are low in glycemic index and have small amounts of them. Fruits that are in this category would be your berries and cherries. So your cherry, strawberry, blueberry, raspberry. In Jamaica we have Otaheite apples. Those are excellent. Guavas are not too bad. Bananas, in between. Those are okay to have in moderation. Fruits like your grapefruit is an excellent option. So focus on those fruits rather than the very sweet ones. One final thing. Fruits are known to be amazing ingredients in fruit juices. And we Jamaicans love fruit juices. Now I'll tell you categorically, juices are the worst way to have fruits. What you do basically, you take out the fiber, the very important fiber in the fruits that holds those sugars, and release them slowly into your system and convert into a fiberless drink that you can consume in seconds and spikes your blood sugar in minutes. So fruit juices aren't healthy for anybody, but especially those categories of persons I mentioned. Diabetics, persons who are trying to lose weight, which is like every woman, and cancer patients. You want to especially avoid fruit juices. Instead, focus on your green juices. Your cucumber, which is a fruit, your celery and kale, and you may want to focus on coconut water, have lots of water. But juices from oranges, mangoes, guavas, peaches, apples, they aren't health foods. They aren't healthy at all. In fact, they are disease-causing foods. So yes, Dr. Thomas said, avoid fruit juices. Have non-sweet fruits in moderation and your vegetables in abundance. That's your health tip for today. Have a wonderful and healthy day.